Good morning to all. Today my presentation is on Jones procedure in the management of involutional entropy on the roller coaster. Financial support and sponsorship none, conflict of interest none. In 1960, Lester Jones reported the following changes in a senile eye. The tonicity of the skin and the superficial fascia is lost and they become redundant and less adherent to the underlying preceptal muscle. Senile entropion causes enophthalmos and the pressure of the globe against the tarsi is decreased. Because of enophthalmos and normal atony as a result of aging process, the deep facial layers linked to the base of the tarsus become relaxed. This decreases the pressure on the lower border of the tarsus and increasing pressure in the upper border, thus causing the tarsus to turn inward at 90 degrees. During contraction, the lower preceptal muscle rises above the lower pretarsus muscle. This decreases the pressure at the root of the tarsus and loosens its hold on the basal orbital septum. The contributing etiological factors for involutional entropion are the overriding of the preceptal orbicularis over the pretarsus orbicularis, horizontal laxity of the lid, which is due to the laxity of the medial and lateral canthal tendons, and vertical lid instability is due to disinsertion or dehiscence of the lower lid retractors. Tests to detect the horizontal lid laxity are the positive distraction test and the snapback test. Other pathological findings in involutional entropion are the lateral and the medial canthal tendon laxity, lower retractor laxity, dry eye syndrome, chronic blepharitis and chronic conjunctivitis, corneal abrasions, ulcerations, microbial keratitis, and significant visual loss if it is untreated. What is the principle of Jones procedure? The capsulopalpebral fascia is tightened by the placating the lower eyelid retractors, thus reinforcing the vertical traction power of the lower lid ligaments. Everting sutures pull their transfer their pull to the anterior surface of the tarsal plate, thus placating the attenuated lower lid retractors. They also prevent the upward migration of the preceptal orbicularis by creating a horizontal barrier. Objective is to study the safety and efficacy of Jones procedure in the management of involutional entropion. Materials and methods, study place Department of Ophthalmology at a tertiary care center, Western Odisha. Study period January 2021 to August 2022. Study design, it is a prospective observational study. Inclusion criteria, all cases of involutional entropion. Exclusion criteria, spastic, cicatricial and congenital entropion, and those with previous eyelid surgeries. The surgical procedure: after giving a horizontal skin incision 4 mm below the eyelash line with a diathermy blade, the orbicularis oculi muscle was exposed. After ensuring appropriate homeostasis, the skin flap was elevated and the pre-aponeurotic fat retracted to expose the lower lid retractors. With the help of 5-0 Mercier suture, the lower orbicularis oculi in inferior eyelid retractor and the top portion of the skin incision were stitched together. This becomes the cardinal suture. Two more similar cardinal sutures were placed similar to the central one. These sutures were adjusted to prevent any under or overcorrection. Similar to the cardinal sutures, two more sutures were placed, one medially and one laterally. Patients were evaluated 40 hours post-operative, followed by 2 weeks, 4 weeks and 6 months later. The height of the palpebral fissure and the symmetry between the contralateral and the corrected eyelid was examined. So these are the results. In our study, we had 8 males and 11 females. So there was no significant gender predominance in cases of involutional entropion. In our study, the unilateral entropion was more as compared to the bilateral entropion. After one eye showed infection in the post-operative period due to poor cleanliness, which was treated with antibiotics. One eye showed recurrence, 2 eyes were undercorrected, while the rest 22 eyes were corrected successfully. So this is the before and after image. Involution entropion is one of the commonest type of palpebral malposition. Medical therapy like Botox provides only short-term relief, thus making medical management as the surgical management as single most effective therapy. Lester Jones described the Jones procedure in which he identified the lower eyelid retractors and reattached them to the tarsus. The long-term success of the procedure is contingent upon generation of a fibrotic scar along suture tracks. Safe et al. Found a strong fibrotic and inflammatory reaction in the lower lid tissues 2 weeks post-op. In our study, no significant age and gender differences found. Unilateral cases were more as compared to that of bilateral. Success rate is 88% in accordance with the study done by Costas Bobrodis et al. Jones procedure is safe, effective and cost efficient option for involutional entropion involving the lower eyelid. Our study indicates that after the procedure there is a low risk of reference, minor skin incision is required, short surgical time, quick surgical skill acquisition, no intra-op complications, and it is aesthetically acceptable to the patient. Thank you.